FactsVerse presents the difference between a heart attack and cardiac arrest. Number 1. Heart attack versus cardiac arrest. When most people hear the terms heart attack and cardiac arrest, they often think that they mean the same thing. Many people believe that cardiac arrest is just a technical term for a heart attack. Actually, the two are completely different. They each cause different symptoms, and each one does something different to your body. Coming up, you'll learn the difference between heart attacks and cardiac arrest and how different the two of them actually are. Number 2. What is a heart attack? When there is an obstruction that keeps the blood from circulating, that causes a heart attack. The obstruction is often due to a clogged artery that keeps the blood from flowing properly. Clogged arteries are caused by a variety of things, such as a diet full of saturated fat and sugar, little or no exercise, consuming alcohol, and smoking. The only way to stop the heart attack and prevent further damage is to open up your arteries so that the blood can begin flowing freely again. There are a few different treatments available. The one that the doctor would choose would depend on the extent of the blockage. Number 3. What is a cardiac arrest? Cardiac arrest, also known as ventricular fibrillation, is almost like an electrical problem with your heart. During a cardiac arrest, your heart will start to quiver very quickly and in an uncoordinated rhythm. Without immediate treatment, these contractions can result in the heart stopping altogether. The treatment for a cardiac arrest is to get you breathing again and to get your heart beating again at a normal and safe rhythm. In many cases, this will require a shock to the heart. Number 4. What happens during a heart attack? When you have a heart attack, your heart keeps beating. The issue is with blood flow. When the blood flow is blocked, the heart can't pump blood that is rich in oxygen the way that it should, and this will cause the cells of the heart to shut down. The longer the heart attack goes untreated, the greater the risk of there being permanent damage to the heart. The obstruction is often caused by plaque buildup on the vessel walls. Number 5. What happens during a cardiac arrest? A cardiac arrest is more serious than a heart attack. When the uncoordinated rhythm of the heartbeat causes the heart to stop beating, it can cause the blood to stop pumping through the entire body. A person who's having a cardiac arrest can die within minutes if they don't get immediate medical attention. Number 6. What are the signs of a heart attack? The symptoms of a heart attack are often more obvious than the symptoms of a cardiac arrest. It's not uncommon to experience symptoms hours, days, even weeks before your actual heart attack. The signs of a heart attack differ between men and women. The most common symptoms for men include discomfort or tingling in the arm, back, neck, or jaw, chest pain, shortness of breath, and the most common signs for women include a sudden feeling of dizziness, heartburn, nausea and vomiting, feeling tired for no reason, and cold sweats. Number 7. What are the signs of a cardiac arrest? A cardiac arrest can come on very suddenly. Because the blood will stop pumping through the body, the victim will often lose consciousness and they'll be unable to breathe. They also won't have a pulse because the heart is no longer beating. If they're going to live, they would need immediate medical care. The only chance that you will have of surviving a cardiac arrest is if there is somebody close by who knows what they're doing. Since you'll likely be unconscious and unable to breathe, there's no point in bystanders giving you aspirin. CPR is much more important at such a critical time. Number 8. What should you do if you're having a heart attack? If you think you might be having a heart attack, you should never ignore the symptoms and try to tough it out. If the symptoms are mild, the first thing you should do is call 911. Next, if you're not allergic to aspirin, chew or swallow at least one. It can save your life while you're waiting for the paramedics to arrive. After receiving treatment, it's important to make the necessary lifestyle changes suggested by your doctor to be sure you won't suffer another heart attack. Number 9. What should you do if you have a cardiac arrest? Since you'll be unable to breathe and you'll be unconscious, it's up to the people around you to jump in and save your life. First, they should check if you have a pulse and check to see if you're breathing. If not, they should call 911 and perform CPR, doing chest compressions only. This means pushing hard on your chest about 100 times a minute. They should also ask anybody nearby if they have a portable defibrillator or an AED. If you survive the cardiac arrest, it's important to make the necessary lifestyle changes to prevent it from happening again. You might not be so lucky next time. Number 10. How to avoid having a heart attack or going into cardiac arrest. When it comes to your heart health, you'll need to do the same things to prevent a heart attack and from having cardiac arrest. This is the only way that the two are similar. Living a healthy life is a great way to keep from having a heart attack or cardiac arrest. That means getting regular exercise, eating a healthy, balanced diet, and avoiding fatty foods, alcohol, drugs, and cigarettes. Also, getting plenty of sleep can also help you stay healthy. Subscribe for more!